Well, hi, everybody. Those of you who don't know me, I'm Dr. Brian Nada, and we have these webinars every month now. So I'm the owner of Nada Chiropractic, and Elevation Health is what it's called. I've been in private practice for just over 25 years, and part of my mission is to go out into the community to teach about health and wellness from more of a proactive standpoint or preventive mindset rather than just being reactive. Now, the problem is when people wait for pain, sickness, illness, or disease, they typically enter a more traditional type of system, medical system of drugs and surgeries, and which has its own issues. So I'm here to offer a different approach. And the definition of doctor is teacher. I take that very seriously. And educating people is not enough, I find. But getting people out of awareness and into action is never easy as well. And so I hope to put you on a better path here tonight and inspire you perhaps to take some action, whether it's preventatively or due to a specific problem that you have. So tonight's topic is sciatica and causes and home treatments. And we're going to talk to you about things that you may be able to do at home as well. We're going to be giving you an opportunity at the end, an offer for you to take further action, take those next steps, investigation, and we're going to be about 35 minutes tonight. The common story or theme that I hear in my office is, I hear this from patients that I meet, especially for the first time. They say to me, I'm just tired of covering things up. With drugs, medications, just kind of masking it. I'm tired and I'm sick and tired of being sick and tired. I hear that a lot. They get frustrated. They're not getting answers. They were told maybe that it was just in their head, or they're just getting older and it's really nothing that can be done. So we want to change that for you. We want to look for answers. Imagine for a moment there really might be an answer to your problem, that you may finally have your life back, focus on thriving, not just surviving each day, getting a full night's sleep for the first time in a long time, going for a walk and maybe not having to stop every other step, having to sit down every 5 minutes, and finally being able to book that vacation that maybe you've been putting off and you might feel like going on. So that's our mission. That's what we do on a daily basis. So tonight, to talk about sciatica, definitely we have to talk about the nervous system, of course. And we must talk about the nerves of the body. Your nerves control your entire body. You have a brain, you have a spinal cord, you have the peripheral nerves. They go and touch every cell, every organ in the body. The messages travel from your brain down to your spinal cord, out the 31 pairs of spinal nerves out of your spinal cord and your spine. And they control muscles, they control organs, tissues, cells, immune function, healing, and repair. They basically control every function of the body. So the information also comes from your body, and there's a feedback loop. That's the information comes from your body back up to the brain, and the brain receives the information of what's going on in the body. So there's that feedback system there in the nervous system. It is considered the master system of the body. It coordinates all your other systems. So here's a nice picture of the sciatic nerve, composed of basically 5 different nerves. 2 of them come from your lower back, and 3 of them come from your pelvis, what's called your sacrum area, your pelvic area, sacroiliac area. Then it goes into the butt, the buttock area, goes down the thigh, into the hip, all the way down to the feet and toes. So that's the traveling of that sciatic nerve. Now, symptoms of sciatica or sciatic pain is basically pain in the buttock area, pain in the lower back as well, but especially in that leg. That is worse also when you're sitting. It can be a burning pain, knife-like stabbing, or tingling sensation down the leg. Some people describe it as a red-hot poker or an electric shock. There is also weakness that can happen, numbness, pins and needles, difficulty moving or walking on the leg or foot, and a shooting pain that makes it difficult to stand up, walk long distances, stand up or bend over as well. So the pain, again, can extend from the lower back all the way through the back of the thigh into the hip, again, down through the leg. and to the feet and toes. So here's the thing, you must get to the cause, must get to the cause. The most common causes of sciatica are, sciatica is caused by irritation of the nerve roots. And that encompasses a few things here. Irritation of the nerve roots, of those nerves, those 5 nerves we were talking about, and the sciatic nerve especially, of the lower back of the pelvis area due to the alignment. So the alignment causes irritation of the nerve. A disc bulge or herniation is common as well, that causes irritation on the nerve, and the piriformis muscle. So there can be muscle spasm that irritates the nerve. Degenerative disc disease. Degenerative disc disease is another problem. It's a breakdown of the disc, which allows movement of the vertebrae. That's what the disc does, and acts as cushions and spacing between the vertebrae. So the discs are very important. So here's some of the causes broken down here. We talk about the sciatic nerve, a bulging disc. You see a picture of that. So we're going to discuss that a little bit more. The bulging disc and why that happens. The inflamed muscle. We're talking about the piriformis muscle. The piriformis muscle is very near the sciatic nerve, and when that muscle is in spasm, it can press on the sciatic nerve. And that's in your buttock area, your butt area, the piriformis muscle. Also, muscles have nerve supply, and nerve supply, when the nerve supply is irritated, it causes the muscle spasm. So the nerves go to the muscle. If the nerve is irritated, the muscle goes into spasm as well. You can rub that muscle, but if you don't get the irritation off of the nerve, which is the true cause, you're going to still have the muscle spasm and the problem remains. So you need to look at the causes of the causes. That's our theme for tonight. And you see an irritated nerve there as well, a locked up joint or segment in your spine or pelvic region. The sacroiliac joint is locked up. There's lack of movement in that joint, vertebral joint, malalignment and inflammation of that joint. Again, we'll go into more detail. So again, need to look at the causes of the causes. What's causing the firing and the irritation of that nerve to the muscle that causes the muscle spasm? What's pressing on that nerve? What's causing the irritated nerve? What's causing the disc to bulge or herniate? What causes the disc to degenerate? So here are some x-rays that I've lined up for you. So these are typically what we do in the office. We take side views of the standing x-rays of the spine, and we take views from behind as well. So there are x-rays that are done. Now, first of all, discs can lose water, right? So as we age, there is some loss of water of that disc, but it's not the true cause of a disc issue, especially herniation. The true cause is a structural or an alignment problem. It's a structure, it's your alignment that is a true cause. Let me explain. 4 things to look for when you're looking at the spine and its alignment, through x-ray especially. Number 1, and on the left x-ray here is tipping forward of the upper body. So we're looking at the middle part of the spine. So the head is above that x-ray. The butt is below that x-ray. We're looking at this person from the side, and they are facing, look at me for a sec, they're facing this way, okay? So they're facing to the left there, but they're facing the opposite way. So we're looking from the side of their mid-back. They're lurching forward. They are coming forward. That's what the x-ray is showing. The red lines is the spine, what it's doing compared to the green line of where it's supposed to be. So the upper body is lurching forward, is tipping forward, is stooped forward, okay? The middle picture shows tipping, again, a side view of the lower back. This is a side view of the lower back. We're supposed to have a curve like the green line, and you're seeing the red lines demonstrate there's a very flattened lower back or lordosis. So there is also tipping of the pelvis forward as well. Just like the thoracic, the pelvis is tipping forward, okay? And then again, the flattening of the lower back and that lordosis is very, very flat according to the red lines. That's a big problem. And the one on the right is a behind view of the lower back and the pelvis. And what we're seeing is the right side of that pelvis is tilted up. So hopefully you can see this. You're seeing the red line on the pelvis is lower on the left, higher on the right. That pelvis is definitely tilted lower on the left. They may even have a short leg on that left-hand side as well. But what this is doing is it's causing the lower back to shift to the left. So you see the lower back spine. Again, we're looking from behind. The red line is to the left of that green line. So that's a big problem. There's even a scoliosis there, which we'll discuss in a moment. So firstly, again, we take standing x-rays of the spine to properly assess the alignment. So number one, the left x-ray, mid-back, side view, tipping forward. That includes a head forward posture as well. The center of gravity is being changed there. They have the stooped posture. It puts more pressure on the front of the disc. When the pressure is on the front of the disc, it shoots or forces back the disc backwards, and they bulge or herniate gradually or suddenly. Back to the middle picture. Lower back, a side view, again, shows normal curve and the person's lack of curve, the actual curve, which is flattened. Due to the flattening of that lumbar curve, all the weight of the body and the weight of gravity is being placed on the discs. So the discs are going to break down faster when things are out of alignment. They break down much faster than any normal aging process. The pelvis is also tipped forward, okay, and that's a problem. So we must create a better alignment in these two pictures here, the one on the left, one in the middle, and then the one on the right, again, a behind view of the lower back and the pelvis. The pelvis is tilted down on the left. You see a straight spine. It's now no longer straight. It's crooked, degenerating faster. The leg is shorter on the left, may need a heel lift, but it causes that left piriformis also, the piriformis muscle can spasm because of that tipping of the pelvis. So a lot of things going on there. Now, looking at the side view of the spine on the left. So side view of the person, that's what the spine is supposed to look like from the side view. There's three curves from the side. Your body and your spine is supposed to be straight from the front or back, but three curves from the side. In the middle picture, you're seeing degenerative changes. So here's the relationship. Like a car that's out of alignment, the tires begin to wear out unevenly. There's a little physics engineering principles there. When the car is out of alignment, the tires break down unevenly. So degenerative changes is not normal aging, okay? It's accelerated by abnormal alignment, okay? Abnormal loading is what it's called. Abnormal weight bearing that are being placed on those discs and those joints. It could be the hips, could be the knees, could be the spine. It's called degenerative disc disease, degenerative joint disease, osteoarthritis. It all means the same thing. Itis means inflammation, arth means joint, inflammation of the joint due to the malalignment of the spine. So how does the spine misalign? Due to slips, falls, accidents, sporting injuries, even as a kid, poor posture and things that happen as a kid. The misalignments, though, cause the spine and the joints to break down faster. The joints break down faster when things are out of alignment. Degenerative changes occur, and this can contribute to herniated discs as well. So healthy discs require a couple things here. Basically two things: proper movement of the joint, proper movement of the spine or the hip or knee. The discs have very little blood supply, so you must have movement of the joint. The joint must be able to move properly. It can't be locked up or stuck. Can't be out of alignment as well. But the discs imbibe or they pump when they move properly. The fluid goes in, waste products get taken out. So again, that joint cannot be locked up if you want healthy discs. The second point, balance alignment again of the spine and the vertebrae. So, so when you have a balanced alignment, when things are the three curves from the side, straight from the front and back, it does not cause improper or abnormal or extra loading on those discs, and the discs do not degenerate. Very little at all. It does not matter your age. Very little at all. You don't have loss of center of gravity. You have the proper structure, and that's the healthiest for your spine, your nerves, and your discs. So some of the risk factors of sciatica, again, it comes to alignment. Premature or accelerated changes in the spine, such as degeneration, herniated discs, bone spurring. It is due to an accumulation of slips, falls, accidents, sporting injuries. Causes the spine to go out of alignment, causes abnormal weight bearing. Obesity is a factor. It is a factor. It's not the main factor, but it is a factor. Increasing the stress or the force loads on your spine by excess body weight can contribute to spinal changes that trigger sciatica as well. Your occupation. So a job that requires you to move repetitively in a similar motion, assembly work, to twist your back, to carry heavy loads, or drive a motor vehicle for long periods can play a role in sciatica. Of course, prolonged sitting, even desk jobs. People who sit for long periods of time, have a sedentary lifestyle, work at a desk, are more likely to develop sciatica than active people. A lot of pressure on the disc happens in the sitting position as well. And pregnancy as well, due to the addition of body weight and the shifting of body weight. Pregnant mothers are commonly getting sciatica as well. So here's our investigations. My particular office aimed to fix the cause. So we do a consultation in the office. It's a thorough health history, problem history, the posture as well. We do a standing, what's called three-dimensional postural assessment. We do palpation, so I feel the spine. I have a hands-on procedure to test for passive spine and joint movement and soft tissue abnormalities. So we need to assess if there's scar tissue and how your tissues are working. And there, of course, is a standing gravity-based x-ray. It's called a weight-bearing x-ray of your spine. Cannot be done lying down. It has to be done standing to get the appropriate information. It reveals alignment, positioning of the spine, and degenerative changes of the discs. A motion study, or what's called a penning study, we often do these things as well. That's a motion study or penning study. X-rays reveal vertebral movement problems or aberrations. So how well the spine is actually moving, how well it's working. Typical management of sciatica is, well, medical, medications, over-the-counter or prescribed medications. They certainly don't necessarily fix the cause of the problem, the alignment, things like that, but there's many that are prescribed. Anti-inflammatories, muscle relaxants, narcotics, opioids. Of course, we know the dangers of the opioids. Painkillers, antidepressants have been prescribed to people for pain. Anti-seizure medications, epidural steroid injections now, which have many side effects to all these medications, of course. Steroid injections actually have side effects of decreased bone density, can lead to osteopenia, osteoporosis. It blocks the ability of what's called proteoglycans to form, cartilage to form in the joint, or new cartilage to be formed. And then there's painkillers such as ibuprofen, the Advil, the Motrins, the Proxen. They're sometimes helpful for the pain, but again, beware of the side effects. So again, medical doctors, orthopedists is typical management, is the medical doctor, then the orthopedist perhaps, then perhaps a neurologist, but it may lead to surgery. So it's drugs and surgery is the typical management. Now, as far as surgery, the option is reserved for times when the compressed nerve, like if a person has bowel or bladder incontinence, bowel or bladder issues, that's can be an emergency. But a surgery can be a last-ditch resort as well. When you have that pain, it's just progressively worsening. You've tried everything, say, does not improve with other methods. Now, traditional treatment methods, they focus on the symptoms, correct? So when they focus on the symptoms, a common problem that patients experience with medical procedures is they don't feel like it helps. The problem seems to come back again and again and again. You have to keep taking the drugs. But here, when you think of a symptom, the effect of what you're feeling, it's the result of some underlying condition, wouldn't it be? There's a greater cause. It's the effect. It's not you have to get to the cause, not just cover it up or mask it or treat the effect only. Is it possible that we are not doing the right thing by just treating symptoms? Perhaps, as the cause continues to deteriorate and progressively get worse, we have to think more on that one. Okay, so our approach is called chiropractic biophysics, CBP for short. This is our health approach in my office. The goal is to restore spinal movement and as a result improve function and decrease pain, affecting neurology, the nerves coming out as well. So we also perform and can help things like stooped postures. These people that are quite stooped over, stretching, we do stretching and strengthening, rehabilitation, soft tissue, amelioration, scar tissue. We promote scar tissue healing, soft tissue healing. There's, of course, the spinal alignment correction, getting the curves back, from the side we were talking about, from the front or back, straightening the spine. That's very, very important. Decreasing, again, stooped postures, getting pressure off those discs, getting pressure off those nerves. That's very, very essential to have good health and good spinal function. There's things that are called decompression. We can do spinal cord or spinal decompression in the office as well. And we certainly, for 25 years, have offered anti-inflammatory nutritional advice. So, people discount that, but it's definitely a part of our lifestyle. Teaching is definitely a part of me being a doctor. Doctor means teacher. So we're definitely going to give you information on what you can do to help the body heal better, and decrease the inflammation of those joints, that itis. We are certified. I am certified in also what's called scoliosis care. Very proud of that. I'm the only certified scoli brace provider from here to Toronto. So we do what's called three-dimensional. It's all brand new 3D, scoli brace designs for kids, adolescents, and adults. So here's some home tips, some takeaways for you. We recommend definitely icing cold packs initially. You would understand that it's a natural painkiller, decreases inflammation a little bit as well. You do that initially, first 24, 48 hours. You can add, after a period of time, some hot packs. After a couple of days, you can alternate hot packs and the cold packs. Heat is basically bringing fluid in or blood into the area. That promotes healing of the area, the tissue. Moist heat is the best. And you can alternate doing an icing on the joint and then doing a heating. Again, don't add the heat until at least probably about 48 hours after an injury, say. And there's stretches that, of course, we would provide for you for the low back, the pelvic region. That can help you feel better. Try to hold the stretch for at least 15 to 30 seconds. So here's some examples for you. We're looking, I'll look at the bottom left here, the piriformis. Does that sound familiar? Something I've discussed tonight. The piriformis muscle, right? That nerve gets irritated going to the muscle. But if that muscle is in spasm and it's unrelated to the nerve, a soft tissue injury perhaps can create that. But the piriformis muscle is just a great stretch for sciatica. And there are things that you can do, like on the right-hand side up at the top there, the cat and the camel. That promotes movement, imbibition it's called, or pumping of the discs, pelvic tilting or bridging, pelvic bridges, lumbar bridges. There are things like extension exercises. And again, we would prescribe specific stretches and strengthening exercises tailored to your individual findings and your x-rays. It's very customized, very individualized in our office. So prevention. It's not always possible to prevent sciatica, but here's some following suggestions that may help you in protecting your back here. Exercise regularly. This is an important thing that you can do. Moving the joints, moving the hips, moving the back, moving the spine. It's good for your overall health as well, of course. Pay special attention when you exercise, if you can, to the core muscles. You've all heard of that, I'm sure. Abdomen, low back muscles. Again, we can prescribe these for you. They're essential for proper posture, strength, support, and alignment. And certainly exercises do help. Other preventive techniques, again, maintain proper posture. Don't slouch. When sitting, choose a seat with good lower back support, armrests, swivel base. Consider placing a pillow or rolled towel in the small of your back to maintain its normal curve. Keep your knees and hips level. And if using a computer monitor, try to keep your eyes at eye level. Now, of course, even when sleeping, we do recommend you sleep on your back or on your side, not on your stomach. If you're on your back, maybe you can put a neck pillow. We have those in our office, the contour pillows for the neck, supports the neck curve very nicely. You can put a pillow under your back, under your knees when you're on your back. If you're sleeping on your side, then you have the support again for your neck. You can put a pillow between the knees again. So if you're on your back, pillow underneath your knees, pillow under your neck, a proper pillow under your neck. And if you're on your side, a pillow between the knees, and of course supporting your neck. So good body mechanics, use those. If you stand for long periods, rest one foot like you're washing dishes or something. If you can put one foot up a little higher, about a foot higher, it does take some pressure off of your lower back. When lifting something heavy, of course, let your lower extremities do the work. Move straight up and down, keeping your back straight and bending at the knees. Hold the load, the weight close to your body, and avoid lifting and twisting simultaneously. Find a lifting partner if the object is heavy or awkward. And finally, regular spinal alignment maintenance, getting checked and adjusted on a regular basis. Personally, I am 58 years old. I have been getting adjusted since 21 years of age. That's 37 years. I will never stop getting adjusted. Of course, I do some other things for my health and my well-being as well, but adjustments for me are vital to keep my motor running, to keep my back strong, and to keep me healthy, my disc healthy, being able to enjoy the sports that I play, and things like that. So very important for me. But we get the spine adjusted and checked on a regular basis to keep that spine in proper alignment. Take care of your spine better than you take care of your teeth. I know all of you take care of your teeth, but you can replace your teeth. You can't replace your spine. So the spine contains your nervous system. That's why it is so important. When the spine is out of alignment, due to slips, falls, accidents, sporting injuries, even as a kid, even the birth process itself, it causes faster breakdown of those joints. It causes pressure or irritation on the spinal nerves. Pressure on the spinal nerves can cause neck or back pain, headaches, numbness or tingling in the pain down the arms or legs, sciatica, of course, and many, many other things. And so to let you know, we do have an offer for you. Appreciate you coming on today. We just don't want you to have this information and not have an opportunity to take action, not to procrastinate. The people may tend to wait a little bit too long. We may not be able to help them anymore. So we don't want you to procrastinate. So our offer for you is that we have simply a $29 exam and x-ray. It's outstanding. Normally I charge about $175. It's a full consultation with me, getting to know your individual issues, your problems, and create a customized program for you. But it includes an examination on that day, the consultation, and the x-rays as well, including motion study x-rays and pending study x-rays, which are very, very unique. So it's very thorough. It takes about 30 to 40 minutes. If you want to schedule that appointment, all you have to do is click the link on your right there, and click that link, and we will contact you for scheduling an appointment to come into the office. Okay, so again, there I am adjusting. And finally, you have two choices here actually for your consultation. In the age of COVID, We are doing webinars as well, like tonight. We're doing virtual consultations as well. So number one, you can attend an in-office appointment. That's probably the best way to go. Just press the link, consult, exam, x-ray. Again, we are fully open with the COVID and doing all the COVID safety procedures. You rest assured of that. And number two, we have virtual consultation. So we can do a free 10-minute virtual consultation, speak to you. So you can also click for that, or let us know what you want to do there. But again, the best way probably would just be to make the appointment, come in the office, we'll contact you. I so much appreciate you. I thank you for your participation. We do have these workshops monthly there. So thank you for your time tonight. Again, I'm Dr. Nada of Nada Chiropractic Elevation Health. Now, I just want to mention for those that have maybe been on the chat, I'm just going to stay on the line just for a moment. And otherwise, we are done the webinar for tonight. If you did ask a chat question, I'm just going to take a look here. You're welcome, Sarah. You're very welcome. And Ellen, you're very welcome as well. And we did have just a couple of you lose audio. There was, that tends to happen. We don't know why that happens. It happens rarely, but sometimes the internet. Okay. You're welcome, Evangeline. Thanks for coming on. Appreciate you as always. Yeah, there is. Should I mention there's a recording? So, no. I just want to mention to you there is a recording of this. If you need to get back on, you had a hard time getting on. That we have that ability to give you the link, and you can get back on this thing and look over it again. You're welcome, Ken. Thank you very much for getting on. And Suzanne, love that name, Suzanne. My wife's name is actually Suzanne as well. Can I order products? Yes, you can. And you can call the office and we can talk to you about that. I'm glad, Sarah, that you were able to get back on there. Yeah, Linda, you got back on, I think. I got it back. You think it was on your end there. Yeah, we've done this a number of times, and we think we've got it down on our side there. So it might have been on your end. But we can have our assistant help you if you need. Again, just link up with the office there, and we can have somebody contact you, and next time we can troubleshoot that for you. We can troubleshoot that, so it's a smooth, easy ride next time. So good night, everybody. Okay. Thank you.